Hello, friends. Today we are going to discuss a very important concept, that is the susceptibility to hypoxic conditions of the various terminal nerve endings that innervate the dental pulp. So let us see the question. Yes, so the nerve fibers most resistant to anoxia or hypoxic conditions are, right? So out of the various nerve fibers, according to a Langer and Gasser classification, we have A, B, and C. We have A, B, and C. Of course, amongst A, we have A alpha, beta, delta, and so on, right? But primarily, if we see from the broader perspective, A, B, and C. Now, it is well known that the C fibers are the most resistant to hypoxia. That's point number one, right? Then the A fibers have got intermediate resistance to hypoxic or anoxic conditions. C are the most resistant. This, I think we can all memorize. The order is sometimes slightly confusing, right? And the B fibers are the most susceptible. So what's the mnemonic? What's the mnemonic of remembering this? B and S, bus. भाई हमारा बस हो गया, हमसे ना हो पाएगा. कुछ लोग होते हैं ना हम में से जो स्ट्रेस के टाइम में धराशायी होकर लेट जाते, बस हो गया. तो वो बी फाइबर है. Most susceptible to hypoxia. That is the first ones to die when there are hypoxic conditions in the human body. So whatever organs or tissues that they are innervating, they're the first ones to die. Obviously, for us, the tooth has got majorly C fibers and the A delta fibers and somewhat the A beta fibers. B fibers are very less in the tooth, practically non-existent. That is one aspect. But if someone asks you the order, C fibers most resistant to hypoxia, A fibers intermediate resistance, and B fibers least resistant or most susceptible. Right? Just to revise the mnemonic, bus, B and S bus. Right? हमसे ना हो पाएगा. ठीक है? जैसे hypoxia की conditions आई, B fibers are going to get necrosed, right? Okay. Now the question is, what is the reason? I mean, if you're dealing with a necrotic pulp, then how is it possible that the pulp has undergone necrosis, that there's complete non-vitality of the tooth, but there is the nerve fibers are still alive? How is that possible? That is because these are only the terminal nerve endings that we are dealing with. Their nerve cell bodies are located very remotely in the middle cranial fossa as part of the trigeminal or the Gasserian ganglion. That is why they are able to sustain long periods of starvation and anoxia and lack of oxygen. That is the reason why. Now, what is the clinical correlate? That if you are dealing with a non-vital tooth, going for a root canal treatment, please do give your local anesthesia. Many a times you are going to start your, oh, this is a non-vital tooth. There will be no pain if I do root canal treatment. Absolutely not. Many a times there is pain, and then the patient jumps up and says, "Doctor, what are you doing? Were you waiting for the pain to happen? Uske baad injection doge?" Right? This is a very common thing that is happening with all of us. My students, my clinical students, they ask me, "Sir, this is a non-vital tooth. I'm not going to give local anesthesia." Absolutely not. You have to give local anesthesia, even if you are dealing with a, an unequivocally, you completely confirmed that the tooth is non-vital. Still, you have to give local anesthesia. Friends, this was the question for today. This is Dr. Aishwarya Kaushik. I was ranked 5 in the All India entrance exam in 2011. I topped the Delhi State postgraduate entrance exam in 2011. And important to note here is that back in the day in 2011, we used to have separate exams. It was not one exam through which the state rank was made, right? Secondly, in the senior residency exam in 2014, in AIMS Delhi, I was ranked 2nd, and in MAMC, I topped the examination. So I'm here to help you in realizing your dream, living that glory of being a topper in MDS entrance examinations. In order to register for my complete course, for my classes, you can call me on the numbers shown here, 9899 608 106 and 9958 004326. nowadays you just go to the YouTube channel, subscribe it, see the details. You find your email address there also. You can drop in comments. So the connectivity is just so convenient these days. Anyways, that was it for today. I wish you all the very best. As I always say, just keep studying hard, keep believing in yourself, right? Pat your back, right? And when the time comes, pull the trigger, kill the day. Best wishes.